The advantage of the prosthetic device for carrying is again demonstrated. Wendy opens the refrigerator door with her knee because, according to her, it is easier. Yet she uses the handle on the freezer compartment to pre-position her shoulder in humeral flexion to facilitate reaching into the refrigerator chamber. Wendy demonstrated her right-footed ability in personal hygiene. Here, she uses right and left interchangeably. Wendy's parents insist that she be responsible for preparing her own breakfast and performing other assigned daily household tasks. In this powered upper extremity device, there is a coordinated 4-bar linkage between the elbow and the wrist, so that with elbow flexion, there is wrist rotation that points the terminal device toward the mouth. It would appear that there has been a complete substitution, foot for hand pattern. Prosthetic writing for the shoulder disarticulation level is really torso manipulation of the prosthesis. Foot writing is toe manipulation of the writing instrument. Both of these are probably a kind of drawing of a central image. Both patterns of drawing are personalized for the individual. Notice the dexterous manner in which the pages are turned. The absolute necessity for assistive foot function in dress and undress is here demonstrated. Hip mobility is essential. It has been mentioned before that Wendy is equally dexterous with her right or left foot, but here it is clearly evident that she probably is left foot dominant. When questioned concerning how she maintained sitting balance and how she learned to play ping pong, she was unable to identify any specific sequence of events that led to this demonstrated competence. She simply wanted to play, tried it, and practiced. The tibio-talar and hind foot complex can apparently reproduce the variety of motions that we normally associate with forearm and wrist mobility. We do not know exactly what Wendy does to prevent striking her head on the floor of the pool. She wanted to swim, was given the opportunity, and has acquired the skills you observe. The mechanism is undoubtedly hyperextension of the entire spine. She can perform equally well on a 3-meter board. The use of her head and shoulder as an adaptive mechanism of stabilizing her trunk when climbing out of the pool is well demonstrated. Wendy's ability to alter her swimming pattern and simulate butterfly, breaststroke, side stroke, and backstroke is remarkable. This sequence demonstrates the high level of skill and grace that can be developed in a well-motivated patient with this degree of disability. Wendy is undoubtedly a superior performer, but not unique. In our patients with bilateral upper amalia who have legs of adequate length and full mobility, many of them have developed functional and recreational skills that are similarly outstanding, but related to their personal desires and motivations. One might wonder whether prosthetic fitting and intensive occupational therapy training are necessary. It is important to remember that this patient has had 12 years of continuing inpatient and outpatient prosthetic and training service. She has had the opportunity to try a variety of rehabilitation procedures or techniques. On the basis of her personality and discriminatory judgment, she has found a compromise that permits this level of accomplishment.